Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Alpha-1 Antitrypsin Deficiency. Introduction. Alpha-1 antitrypsin deficiency is an inherited disease where the body does not make enough of the protein alpha-1 antitrypsin, or AAT for short. It can cause lung and liver problems. Doctors do not know how many people have AAT deficiency. Many people who have the condition may not know they have it. It is estimated that about 1 in 2,500 people have AAT deficiency. This program explains what alpha-1 antitrypsin deficiency is and what causes it. It also covers how AAT deficiency is diagnosed and the available treatment options. What is alpha-1 antitrypsin deficiency? Our bodies need proteins to grow, make new cells, and repair tissues. Alpha-1 antitrypsin, or AAT, is a protein made in the liver. Normally, AAT travels through the bloodstream. It helps protect the body's organs from being destroyed by other proteins released by the body to fight germs. The lungs are one of the main organs that the AAT protein protects. AAT deficiency happens if the AAT proteins in the liver are defective. They get stuck inside liver cells and can't get into the bloodstream. As a result, not enough AAT proteins travel to the lungs to protect them. This increases the risk of lung disease. Liver disease can also develop because too many AAT proteins are stuck in the liver. Severe AAT deficiency happens when blood levels of the AAT protein fall below the lowest amount needed to protect the lungs. In some severe cases, no AAT protein can be found in the bloodstream. Symptoms. AAT deficiency can be mild or severe. The symptoms of the disease depend on its severity. The first lung-related symptoms of AAT deficiency often begin between the ages of 20 and 40. Symptoms may include difficulty being physically active, shortness of breath, wheezing. Wheezing is also a symptom of asthma. Often, people with AAT deficiency are first diagnosed with asthma for this reason. Some people with severe AAT deficiency develop emphysema at an early age, usually in their 40s or 50s. Emphysema is a serious lung disease in which damage to the airways makes it hard to breathe. Emphysema can cause chest tightness, ongoing cough, problems breathing, wheezing. Some people who have AAT deficiency develop cirrhosis and other serious liver diseases. Cirrhosis is a disease in which the liver becomes scarred and doesn't work well. In some people with AAT deficiency, cirrhosis and other liver diseases happen during infancy and early childhood. If AAT deficiency affects the liver, symptoms may include dark-colored stools, itching, jaundice or yellowing of the eyes and skin, poor appetite, swelling of the abdomen and legs, vomiting blood. A very small number of people who have AAT deficiency develop painful lumps under or on the surface of the skin. Other symptoms of AAT deficiency are rapid heartbeat upon standing, repeated lung infections, tiredness, vision problems, weight loss. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Alpha-1 antitrypsin deficiency is inherited, which means children get the gene from their parents. This section explains the genetic cause of AAT deficiency. Genes tell the body to make certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also have a lot to do with our health. Each person has 23 pairs of chromosomes. Genes are found on the chromosomes. The genes that control how the cells in the body make AAT proteins are called AAT genes. There are many possible combinations of AAT genes that can happen. Whether a child has health problems depends on which AAT genes he or she inherits from each parent. Sometimes a child will only be a carrier, meaning he or she can pass on a defective gene but has no health problems. To learn more about the possible combinations of AAT genes and their effects, talk to your healthcare provider. Some medical facilities offer genetic counseling. Genetic counseling provides information and support to people who have or may be at risk for genetic disorders. A genetics professional meets with you to discuss genetic risks. You may follow up with genetic testing. Diagnosis. Alpha-1 antitrypsin deficiency is usually diagnosed after a person develops a lung or liver disease that is related to AAT deficiency. To diagnose AAT deficiency, your healthcare provider will ask about your medical history. Often people with AAT deficiency have been previously diagnosed with asthma. Others may have emphysema at an unusually early age. Your healthcare provider will also ask about your family's medical history. If you have blood relatives with AAT deficiency, you are more likely to have the condition. Medical tests can confirm a diagnosis of AAT deficiency. Certain tests may also be used to check for lung or liver problems related to AAT deficiency. A genetic test is the most certain way to diagnose AAT deficiency. This test will show whether you have defective AAT genes. A blood test may also be used to check the level of AAT protein in your blood. If the level is a lot lower than normal, it is likely that you have AAT deficiency. If you have a lung or liver disease related to AAT deficiency, your healthcare provider may recommend additional testing. Lung function tests can be used to see how severe a lung disease is. These tests measure how much air you can breathe in and out, how fast you can breathe air out, how well your lungs deliver oxygen to your blood. The severity of liver disease can be measured with blood tests. Blood tests can help show how well the liver is working. Imaging tests can also show how severe a lung or liver disease is. Some imaging tests that may be used include an MRI or a CT scan. Treatment. Alpha-1 antitrypsin deficiency has no cure. However, the diseases related to AAT deficiency have many treatments that can help manage the symptoms. Medicines called inhaled bronchodilators and inhaled steroids can help with lung diseases. These medicines open the airways and make breathing easier. Pulmonary rehabilitation can also help with the lung-related symptoms of AAT deficiency. Pulmonary rehabilitation focuses on learning how to manage a lung condition. It may include breathing techniques, exercise, and counseling. Oxygen therapy may also be used to treat some lung diseases. The extra oxygen often makes breathing easier and allows a person to be more active. Severe breathing problems may require a lung transplant. A lung transplant is surgery to remove a person's diseased lung and replace it with a healthy one. Augmentation therapy is a treatment used only for people who have lung problems related to AAT deficiency. This therapy involves getting injections of the AAT protein. The injections raise the level of the AAT protein in the blood and lungs. There is no specific treatment available for liver problems caused by AAT deficiency. However, in severe cases, a liver transplant may be done. A liver transplant replaces a diseased liver with a healthy one. Preventing complications. There are many steps you can take to prevent complications caused by AAT deficiency. This section offers 6 tips for protecting your lungs and liver when you have AAT deficiency. 1. Get vaccinated. Receiving the flu and pneumococcal vaccines can help protect you from illnesses that will make lung symptoms worse. Also, hepatitis A and B vaccines can protect your liver. 2. Get regular checkups and medical tests. Your healthcare provider can better monitor your condition if you follow his or her advice. Tests can also show if a lung or liver disease is getting worse. 3. Stay away from cigarette smoke and heavy air pollution. This can help protect your lungs from damage. Also, avoid other respiratory irritants like household chemicals or dust and pollen. 4. Avoid drinking alcohol. Alcohol can damage the liver and make the damage caused by AAT deficiency worse. 5. Eat a balanced diet and maintain a healthy weight. Talk to your healthcare provider or a dietitian if you need help planning meals or an exercise program. 6. If you develop the symptoms of a lung infection, contact your healthcare provider right away. Treating an infection early can prevent further complications.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Alpha-1 antitrypsin deficiency is an inherited disease where the body does not make enough of the protein alpha-1 antitrypsin, or AAT for short. AAT deficiency most often affects the lungs and liver. It is estimated that about 1 in 2,500 people have AAT deficiency. The lungs are one of the main organs that the AAT protein protects. AAT deficiency happens if the AAT proteins in the liver are defective. They get stuck inside liver cells and can't get into the bloodstream. As a result, not enough AAT proteins travel to the lungs to protect them. Alpha-1 antitrypsin deficiency is inherited, which means children get the gene from their parents. People who have alpha-1 antitrypsin deficiency inherit 2 defective AAT genes, one from each parent. Alpha-1 antitrypsin deficiency has no cure. Augmentation therapy is a treatment used only for people who have lung problems related to AAT deficiency. There is no specific treatment available for liver problems caused by AAT deficiency. You can do a lot to prevent further complications caused by AAT deficiency. Talk to your healthcare provider for more information. Thank you for using Explain.